Robert, about 50 years old, working an office job in New York City. Every morning, you wake up with chest pain and difficulty breathing, as if a heavy weight is pressing on your heart. Just climbing a few stairs leaves you exhausted and dizzy, filled with the constant fear of a sudden heart attack. You visit your doctor, and the diagnosis is ischemic heart disease, a condition where the heart muscle doesn't get enough blood, putting you at high risk for a heart attack. Robert's life suddenly changed. He's worried about his family, fears a sudden death, and has to face a bland, strictly controlled diet. But is there a way to turn everyday meals into natural medicine that not only strengthens the heart, but also tastes delicious? Today, we'll dive deep into nutrition for patients with ischemic heart disease. I'm not just going to list foods. I'll explain each one in detail: what it is, why it's crucial for reducing heart disease risk, and how to practically incorporate it into your meals so you can do it easily at home. Are you facing a situation like Robert's? Share your experience in the comments below so we can talk. First, let's understand how nutrition plays a vital role in helping patients with ischemic heart disease. The condition occurs when coronary arteries narrow or become blocked, leading to insufficient blood flow to the heart, which causes chest pain, fatigue, and an increased risk of stroke. Food not only provides nutrients, but it also helps lower bad cholesterol, control blood pressure, fight inflammation, and improve blood circulation. Why is it important? Because it solves the core problems. It reduces the heart's workload, prevents complications, and gives you comfort and energy to live your daily life to the fullest. How do you do it? Start by diversifying your menu with foods rich in fiber, omega-3s, vitamins, and antioxidants. Check by regularly monitoring your cholesterol levels with a physical exam and feel the change through reduced fatigue. Now let's start with the top food items that are easy to find at the market or supermarket so you can start using them immediately. First up is oats, a whole grain ground from oat groats rich in beta-glucan fiber. What are they? A simple food available in rolled or steel-cut varieties. They're naturally gluten-free. Why use them? The fiber in oats acts like a sponge, soaking up bad cholesterol, LDL, in the intestines and preventing it from being absorbed into the bloodstream while preserving good cholesterol, HDL, to protect arterial walls. In addition, omega-3s, folic acid, and potassium help improve blood circulation, reduce inflammation, and maintain a healthy heart rhythm, which directly addresses the problem of insufficient blood supply to the heart. Research from leading health organizations shows that regular consumption can lower total cholesterol by 5 to 10% within a few weeks. How? Start with breakfast. Cook oatmeal with 50 grams of oats, add skim milk and sliced bananas. Condition: choose an unsweetened variety. Action: bring 200 milliliters of water to a boil. Stir in the oats and cook for 5 minutes. Check. Eat 3 times a week and observe if chest pain decreases. Have you ever tried oatmeal? If so, what's your favorite way to eat it? Share your experience in the comments below. Next is olive oil, a healthy fat extracted from olives famous in the Mediterranean region. What is it? There are 2 main types: virgin, filtered to remove impurities, light yellow, mild flavor, and extra virgin, cold-pressed mechanically, preserving nutrients, deep green, slightly peppery flavor. Why use it? It contains monounsaturated fatty acids, MUFAs, that help lower LDL cholesterol without affecting HDL and fight inflammation in the arteries, reducing the risk of ischemic heart disease worsening. The major benefit? Your heart is less burdened, blood flows better, helping you avoid sudden pain. How? Use it to replace regular cooking oils. Mix 1 to 2 tablespoons into a salad or drizzle it over grilled fish. Condition: limit to 2 to 4 tablespoons a day to avoid excess calories. Action: choose extra virgin olive oil with the free fatty acid content below 0.8%. Store in a cool place. Check. After 1 month, check if your blood pressure is more stable. Your challenge: this week, try swapping your frying oil for olive oil in one dish and tell us the results in the comments. Next is avocado, a familiar tropical fruit with green or black skin and creamy yellow flesh. What is it? Rich in carotenoids, antioxidants, folate, potassium, and healthy fats. Why is it important? Carotenoids prevent heart cell degradation, Folate prevents stroke by reducing homocysteine, a substance that damages blood vessels. Potassium regulates blood pressure, and healthy fats control cholesterol and increase feelings of fullness to prevent overeating that burdens the heart. This solves the problem. It reduces the risk of complications and provides sustainable energy for daily activities. How? Eat with vegetables. Blend half an avocado with steamed carrots and spinach to enhance nutrient absorption. Condition: eat when ripe, no more than one per day if you're watching your weight. Action: slice it, sprinkle with a little salt, and eat it with whole wheat toast. Check. Notice how full and energized you feel after the meal. Do you think avocados are easy to incorporate into American meals? Share your recipe ideas. Next up are broccoli and spinach, nutrient-dense leafy greens. What are they? Broccoli is a cruciferous vegetable with green tree-like florets. Spinach has broad, dark green leaves. Both are high in fiber, vitamins C and K, minerals, and sulforaphane, an anti-inflammatory compound. Why use them? They lower cholesterol by binding to bile acids, clean arterial walls, and repair damage from high homocysteine levels, which is a major cause of ischemic heart disease. Vitamin B helps repair damage, strengthening the heart for the long term. Benefits: prevents plaque formation, controls blood pressure, and gives you a feeling of freshness. How? Add to meals. Blanch broccoli for 5 minutes, mix with fresh spinach in a salad. Condition: eat raw or steamed to preserve nutrients. Action: eat 200 grams a week, mixed with lean protein. Check. Observe if your blood pressure drops after 2 weeks. Interactive question: which leafy green do you prefer and how do you cook it? Comment below. Next is the tomato, a juicy red fruit found in every American kitchen. What is it? Tomatoes contain lycopene, a powerful antioxidant, along with vitamin C, potassium, and fiber. Why use it? Lycopene prevents cholesterol from sticking to cell walls, lowers triglyceride levels, blood fats, which are culprits in artery narrowing in patients with ischemic heart disease. It also eliminates free radicals, protecting the heart from damage and reducing the risk of disease flare-ups. The clear benefit? Your heart works better, you feel lighter, and your worry about sudden pain is reduced. How? Add tomatoes to your daily meals. Eat one raw, about 150 grams, in a salad, or drink 150 milliliters of juice. Condition: avoid eating on an empty stomach to prevent acid reflux. Action: slice it up, mix it with cucumbers and parsley, and drizzle with a little olive oil. Check. After 2 weeks, see if you feel less tired when you move around. Do you prefer raw or cooked tomatoes? Share your favorite tomato recipe in the comments. 6 is garlic, an indispensable spice in American cuisine, from savory stir-fries to marinades. What is it? Garlic contains allicin, a bioactive compound formed when it's finely chopped, along with antioxidants and sulfur. Why use it? Allicin helps dilate blood vessels, improving blood flow to the heart, lowering blood pressure, and preventing blood clots, which are a major risk factor for ischemic heart disease. Garlic also inhibits the production of bad cholesterol in the liver, helping your heart breathe easier. Benefits: reduces the risk of a heart attack, giving you confidence when you move. How? Add garlic to dishes. Finely chop 1 to 2 cloves of garlic, let it sit for 5 minutes to let the allicin activate, and then sauté it with vegetables or add it to a soup. Condition: use fresh garlic, don't overcook it to preserve nutrients. Action: add 1 clove a day to your meals. Check. Monitor your blood pressure after 1 month. Challenge: this week, try adding garlic to a familiar recipe, like a stir-fry. How do you feel? Comment below. Next are legumes. From lentils and black beans to soybeans, they're easy to find in the American market. What are they? Legumes are a source of plant-based protein rich in soluble fiber, omega-3s, vitamin E, and calcium. Why use them? The soluble fiber in legumes traps bad cholesterol in the intestines, reducing its absorption into the bloodstream, while omega-3s and vitamin E protect arterial walls from inflammation, helping reduce the heart's workload, prevent plaque, and provide sustainable energy. How? Mix into meals. Boil lentils for a savory stew or blend soybeans to make milk for a morning drink. Condition: choose whole legumes, avoid adding sugar. Action: eat 50 grams of legumes a day, boiled or steamed. Check. Notice if your cholesterol improves after a physical exam in 6 weeks. What's your favorite legume? Share how you cook them in the comments so we can all learn from each other. Eighth is salmon, a premium seafood that's increasingly popular in the US. What is it? Salmon contains omega-3s, EPA, and DHA, high-quality protein, and vitamin D. Why use it? Omega-3s lower triglycerides and bad cholesterol while preventing arterial inflammation and blood clots, which are major risk factors for ischemic heart disease. Salmon research indicates that eating salmon twice a week can reduce the risk of heart complications by 50%. Benefits: your heart gets stronger and you can move with confidence without fear of getting tired. How? Simple preparation. Grill a salmon fillet with olive oil, sprinkle with herbs, and eat with steamed vegetables. Condition: choose fresh fish, avoid deep frying. Action: eat 100 to 150 grams a week. Check. Observe your energy levels after 3 weeks. How often do you eat salmon? If you don't, what kind of dish would you like to try with it? Share in the comments. Next is yogurt, a fermented food that's friendly to both the heart and the gut. What is it? Yogurt contains probiotics, good bacteria, B vitamins, calcium, and antioxidants. Why use it? Probiotics improve the gut microbiome, reducing inflammation throughout the body, which in turn supports the heart. Calcium and B vitamins control blood pressure, lower bad cholesterol, and prevent plaque. Benefits: better overall health. You feel lighter and your digestion improves. How? Eat for breakfast or as a snack. Choose unsweetened yogurt and add fresh fruit like strawberries. Condition: use 100 to 150 grams a day. Avoid varieties with a lot of added sugar. Action: mix with oats or berries. Check. Monitor how full you feel and your digestion after 2 weeks. Do you have a yogurt habit? Tell us your favorite yogurt dish. 10th is watermelon, a sweet and juicy fruit popular in the US. What is it? Watermelon contains lycopene, citrulline, fiber, and vitamin C. Why use it? Lycopene is an antioxidant that protects the heart from free radicals. Citrulline helps improve blood flow by dilating blood vessels, reducing the heart's workload, controlling blood pressure, and giving you a feeling of freshness. How? Eat it fresh. Slice up 200 grams of watermelon for dessert or drink the juice. Condition: avoid adding sugar. Action: eat 2 to 3 times a week. Check. Observe your blood pressure and energy levels after 1 month. How often do you eat watermelon in the summer? Share how you enjoy it in the comments. Next are berries. Like grapes, blueberries, raspberries, and strawberries, they're easy to find in American supermarkets. What are they? Berries are rich in flavonoids, anthocyanins, and fiber. Why use them? Flavonoids increase good cholesterol, HDL, lower bad cholesterol, LDL, and fight inflammation in the arteries. Research shows that regular consumption of berries can reduce the risk of a heart attack by 30%. Benefits: your heart is stronger and you feel younger and more energetic. How? Add to meals. Mix 50 grams of berries into yogurt or eat them fresh as a snack. Condition: choose fresh or unsweetened frozen berries. Action: eat 3 times a week. Check. Observe your feelings of fatigue after 4 weeks. What's your favorite berry? Share in the comments. Finally, turmeric, a golden spice in American cuisine. What is it? Turmeric contains curcumin, a powerful anti-inflammatory and antioxidant compound. Why use it? Curcumin controls cholesterol, reduces inflammation in the arteries, and improves heart function, reducing the risk of an enlarged heart. Benefits: your heart is stronger, you feel lighter, and you're less worried. How? Add to dishes. Add a ½ teaspoon of turmeric powder to a curry or warm milk. Condition: use with a little black pepper to increase absorption. Action: Add to 2 to 3 meals a week. Check. Observe chest pain symptoms after 4 weeks. Have you ever used turmeric in your cooking? Share your favorite turmeric recipe. For the best heart health, in addition to diet, don't forget to quit smoking, limit alcohol, avoid fried and high-sugar foods, divide your meals into smaller portions, and prioritize steaming, boiling, and grilling while increasing your intake of vegetables and whole grains. Proper nutrition not only helps keep your heart healthy, but also gives you a better quality of life. Are you ready to change your diet? Start with one item from this list, try it for a week, and share the results in the comments. Don't forget to like, share, and subscribe for more heart health tips. Comment on which item you'll try first. I want to hear your story.